This talk is about Hemifield pattern reversal visual evoked potentials. It is intended for the clinical neurophysiology fellows at Nicklaus Children's Hospital. The talk will be conducted using a question and answer format. The first question is, what are the indications for Hemifield pattern reversal visual evoked responses? A. Confirming full field pattern reversal visual evoked potential abnormalities. B. Detecting optic tract lesions. C. Detecting optic radiation lesions. B. Diagnosis of optic neuritis. MRI has rendered Hemifield pattern reversal visual evoked potentials a thing of the past. But once in a while, it is resurrected by one or another investigator. So it is good to know something about them. Its role, other than for investigational purposes, is now restricted to confirming chiasmatic or post-chiasmatic pathology detected by full field visual field testing. I think this paper, published in 1977, still is the best paper on the subject. I strongly recommend you to read it, and it is the kern of this talk. So the answer to this question is A. Next question. Half field testing may demonstrate visual pathway abnormality in the presence of a normal full field pattern visual evoked potential. A. True. B. False. This paragraph is from the 2008 guidelines. And a statement in it says that half field can be abnormal in the presence of a normal full field pattern reversal visual evoked potential. This view is not shared by others in the business. That is the reason they recommend half field to be done only when full field is abnormal or questionable. So the answer to this question is true. Next question. Half field testing may be done A. One hemifield at a time. B. Both hemifield of the same eye during one study. C. Both right or left hemifields of each eye simultaneously during one study. D. All of the above. This frame has listed the different methods of Hemifield pattern reversal visual evoked potential testing. The first method consists of independent testing each half of the visual field on their own. This is the old-fashioned way. Newer equipment can do two hemifields during the same study. When the right hemifields of both eyes are stimulated at the same time, or when the left hemifields of both eyes are stimulated at the same time, the study is labeled binocular. When both fields of the same eye are stimulated in an alternating fashion, the study is labeled monocular. Monocular method is more sensitive than the binocular method, but it takes longer and requires more patient cooperation. The monocular method can be used to complement full pattern reversal visual evoked potentials when the full study shows an on-cross asymmetry or a cross asymmetry. The binocular method can only be used when the asymmetry is uncrossed. So the answer to this question is D. Next question. A full field stimulation P100 with a minimum of -microvolt is needed to be able to successfully perform Hemifield visual evoked potentials. A 5, B 10, C 15, D 20. If the amplitude of a full field pattern reversal P100 is less than 5 microvolts, Hemifield studies are likely to be plagued with artifacts and be unreliable. So the answer to this question is A. Next question. What should the size of the checks be in a checkerboard for Hemifield monoocular visual evoked potentials? A 30 minutes, B 120 minutes, C 60 minutes, D 20 minutes. This frame illustrates the difference between the board and the checks sizes most commonly used for full and Hemifield pattern reversal visual evoked potentials. For full field evaluation, we should use a board of 8 degrees and checks of 30 minutes. For half field evaluation, the board should be at least 16 degrees and the checks be 50 minutes as recommended by the Academy or 60 minutes as shown in this frame. Yet all this depends on the choice of the investigator. So the answer to this question is C. Next question. The fixation point in monoocular Hemifield pattern reversal visual evoked potentials should be placed on the edge of the checkerboard. A true, B false. The fixation point for half field stimulation should be displaced away from the inner edge of the pattern into the non-stimulated area. This should be done by about 1 check size or 1 degree, which come to be the same distance from the edge of the stimulus when using 60 minutes checks. Some newer equipment have the capability of stimulating monoocular right and left half of the visual field simultaneously. By alternating the site of the stimulus. So the answer to this question is B. Next question. Hemifield pattern reversal visual evoked potential using a checkerboard of 16 to 32 degrees and checks of more than 20 minutes test preferentially the A. fovea, B. foveola, C. perifovea and surrounding retina, D. umbo. Check sizes of 40 minutes or more primarily stimulate the perifovea and the retinal surrounding areas. But also, although to a lesser extent, they stimulate the parafovea and the fovea. In this frame, the stimulus is presented in such a way as to stimulate the nasal retina. Here, the stimulus is presented in such a way as to stimulate the temporal retina. Using boards and checks of a smaller size increases stimulation of the parafovea and the fovea, while decrease the stimulation of the perifovea and the surrounding retina. So the answer to this question is C. Next question. Left visual half-field testing of the right and left eye will produce occipital fields with vectors pointing to the left occipital electrode. A true, B false. This frame depicts the electrical field occurring in the right occipital visual cortex. Such a field produces a vector towards the other side. So at about 100 milliseconds, it will produce a field that we will call P100. This field, as we just mentioned, will be maximal over the left occipital electrode. A right field can be produced by stimulation of the right eye temporal retina by a left-sided stimulus as depicted in this frame, or after stimulation of the left eye nasal retina by a field presented over the left side. So the answer to this question is A. Next question. Right visual half-field testing for the right and left eyes will produce occipital fields with vectors pointing to the right occipital electrode. A true, B false. Left occipital visual cortex activation creates a field with a vector best captured at the right occipital electrode. So, stimulation of the right visual field of the left eye produces a field with the highest intensity on the right occipital electrode. And right visual field stimulation of the right eye produces an energy field with the same characteristics. So the answer to this question is A. Next question. Right visual full field testing of Ocular Uterki will produce occipital fields with vectors pointing to the right occipital electrode. A true, B false. The word Uterki means both in Latin. That is why at times you will see the term OU for both eyes and AU for both ears. So the answer to this question is B. Next question. Right monoocular full field stimulation will produce an occipital field with a vector pointing to the midline. A true, B false. Monoocular stimulation, which combines macula and extramacular activation, produces four vectors that, when combined, generate a single vector. This vector is maximally directed towards the midline. So the answer to this question is A. Next question. The peaks in half-field stimulation and full-field stimulation are the same. A true, B false. Monoocular full-field stimulation produces three consistent peaks, N75, P100, and N145. These peaks occur in all occipital electrodes in most normal individuals. In this new frame, the right eye monoocular stimulation is presented. The stimulation is being introduced in the left visual field. The white line I have just added divides the occipital area in two regions. The region ipsilateral to the stimulus, that is the sagittal occipital electrode, and the parasagittal occipital electrodes on the side of the stimulus, generate waves that with the same peaks as those observed after monoocular full field stimulation. They include N75, P100, and N145. On the opposite side of the white line, that is on the contralateral side to the stimulus, we also find three peaks. They are N105 and P35. This constellation of peaks is often referred to as the contralateral PNP complex, or simply the PNP complex. This is done so to distinguish it from the ipsilateral NPN complex. In this new frame, the stimulus to the right eye is presented over the left visual field. The peaks that result from this stimulus is consistent with those found with right field stimulation that I have just presented. We do have to take into account the ipsilateral and contralateral switch. So the answer to this question is B. Next question. The relevant peaks in half-field stimulation and full-field stimulation are the same. Visual evoked potentials are also called the P100 test for a reason. The reason is that in most instances, the only relevant peak is P100. So the answer to this question is A. Next question. The N105 that may be detected using MO to FC derivation during full field monoocular stimulation, and the N105 that may be detected using LO to FC or RO to FC derivations during half field stimulation are the result of the same electrical field. A true, B false. This question pits two N105 peaks. The origin of the N105 peak that is encountered in derivations using sagittal occipital electrodes, such as those that use OZ, MO, or anion, referred to FC, can be understood by remembering that most of the time a more robust P100 is found when OZ is referred to FC than when OC is referred to A1. And that is because when we record from OC to A1, we exclude the negative field that occurs in the mid-frontal region at about the same time as the P100 occurs in the occipital region, a peak to which we can refer to as N105. So now that we know that the N105 that arises during full field pattern reversal visual evoked potentials from the sagittal frontal region is an independent field, I will tell you about the N105 peak that arises during Hemifield pattern reversal visual evoked potentials from the parasagittal occipital region. When stimulating the right visual field of the right eye, as I have depicted in this frame, the occipital electrodes on the same side of the visual field stimulated are called the parasagittal ipsilateral electrodes. The occipital electrodes on the contralateral side to the one being stimulated are called the contralateral parasagittal electrodes. As we mentioned in answering the prior question, the sagittal occipital electrode and the ipsilateral parasagittal electrodes, when activated, capture the typical NPN complex, whereas the parasagittal contralateral electrodes capture the PNP complex. I will provide you with an example. At the right lateral occipital electrode, we see the N75 that is also present at the right temporal electrode in green and at the occipital sagittal electrode in white. This coincides with the P75 recorded at the left temporal electrode. Then comes the P100 in the right parasagittal and mid-occipital electrodes. Then the N105 appears. This wave is maximal in the left temporal electrode, but it can also be present in the left occipital electrode. This peak is followed by N135 that appears maximal in the left temporal electrode but can also be seen in the left occipital electrode. Finally, we get the N145 peak, which is present in the sagittal and ipsilateral parasagittal occipital electrodes. So parasagittal N105 seems to originate at the occipital lobe, whereas sagittal N105 seems to originate from the frontal lobe. So the answer to this question is B. Next question. Peaks produced by half-field stimulation do not change if the perimacular region is excluded. A. True. B. False. This frame depicts a left visual field stimulation of the left eye. Such an stimulation produces maximal activation of the right occipital visual cortex. and the maximum field to be captured on the left occipital electrode, with significant presence of the left temporal and mid-occipital electrodes. These electrodes will have the NPN complex, whereas in the contralateral electrodes, that is, in the right occipital and right temporal electrodes, we would find less well-defined waves forming the PNP complex. In this frame, I have represented the waves I just mentioned matching line colors to electrode colors. Here I have placed a yellow line through the 100 millisecond mark after the stimulus. As you can see, the larger waves are the P100 from the ipsilateral, parasagittal, and sagittal occipital electrodes. On the other side, the side opposite to the stimulus, there are multiple ill-formed waves, representing the PNP constellation, including the N105. Now a new field is introduced in the same fashion, except that the foveal area is blocked. You can tell because I made it white, thus creating an artificial central scotoma. Such stimulus will produce a set of waves with different characteristics. I have now marked the 100 millisecond in these new waves in order to highlight the loss of the sharp configuration of the ipsilateral, parasagittal, and sagittal waves, and the clearer presence of a negative wave arising from the contralateral parasagittal electrodes. These waves, especially the one from the left temporal electrode, has a well-defined peak at 105 milliseconds. This trend becomes more pronounced as the central scotoma is enlarged up to a point at which only the lateral retina is stimulated and the waves as a whole lose all their typical characteristics. This explanation is presented in the Eversole book to explain the contribution of the lateral retina to the formation of the occipital encounter in 105. So the answer to this question is B. Next question. Which of the following derivations will better demonstrate a posterior N105 after right hemifield stimulus presented to the left eye in a patient with a central scotoma? A. RT 2MF, B. RO 2MF, C. LO 2MF, D. OM 2MF. Stimulation of the left half field of the left eye demonstrate relatively poor waveforms ipsilateral to the stimulation, and very well formed waves contralateral to the stimulation, especially in the RO to MF derivation. Notice that there is something very unusual in this frame, and that is that N105 is better formed than P100. Stimulation of the right half field of the left eye produces a prominent NPN complex ipsilateral to the stimulation, with a relative well-formed P100. Please notice the difference between the P100 present after stimulation by the right side of the left eye, which, as you know, activates the temporal retina of the left eye, and the P100 present on stimulation of the left half of the left eye, which, as you know, occurs due to activation of the nasal retina of the left eye. Now let's go back to the other side. As you can see, opposite to the stimulation side, the waves are ill-formed, but still you can see a discernible P-NP complex. This example is presented in the academic guidelines as an example of half-field visual evoked responses in the presence of a central scotoma. Once again, without doing any calculation, the most important point in this frame is that in normal half-field studies, the P100 is always larger and better formed than the N105. And in this case, when the stimulus is presented in the left side, it is not. This is a clear indication that pathology is present. So the answer to this question is B. Next question. Right visual field stimulation of the left eye activates the temporal retina and produces a field with maximal force to the left side. A true, B false. The right half visual field of the left eye is being stimulated, which corresponds to the temporal retina of the left eye. After going through the chiasm but staying on the same side, these fibers travel in the optic tract and the optic radiations, leading to activation of the visual cortex of the left hemisphere. This activation will produce a field with the main force of the vector pointing to the opposite side, that is towards the right occipital, mid-occipital, or right temporal electrodes. This is an example of a right hemifield stimulation of the left eye. See that the waves with the largest amplitude are captured by the right occipital frontal derivation and the mid-occipital electrode. So the answer to this question is B. Next question. Right eye, right half visual field stimulation will produce P100 waves over the right parasital occipital electrodes. A true, B false. Let us first analyze what happens with right eye testing when presented with the left half visual stimulus. Here we have a representation of the head with the eyes, the visual pathways, the searching electrodes, and two white lines representing the mesial edges of the right and left occipital cerebral cortex and occipital poles. The left eye is patched, and a stimulus is presented in the form of a half circle on the left side. Now I have added the label for the electrodes according to the Queen square system. As you can see, the left parasagittal electrodes and the sagittal electrode captures a robust N75, P100 and N145. The right occipital derivation registers a succession of ill-formed waves, whereas the right temporal electrode captures a relatively well-formed wave complex consisting of P75, N105, and P135. Now, I like to call your attention to the figure of the head to trace the path followed by the stimulus. First of all, the lack of a stimulus on the left patch eye eliminates the visual pathway from that eye as a conduit for the stimulus. Secondly, the lack of activation of the right eye nasal retina excludes the activation of the pathways arising from this area, leaving only those fibers arising from the right eye temporal region as the sole contributors for the activation of the right occipital visual cortex. The activation and processing of the stimulus at the right occipital visual cortex produces several fields at different times, each with a vector towards the mid-occipital and left occipital regions, which I have highlighted in this frame. Now, let's see what happens when evaluating the right eye by a stimulus confined to the right half of the visual field. As you can see, I have just jumped right into the wave formation. So, right visual field stimulus of the right eye activates the nasal retina. Thus, the left eye is not activated because it is patched. Neither is the right eye temporal retina. Therefore, no pathways arise from it. So the only activated pathway is that from the nasal right eye retina, which after crossing the chiasm activates the left occipital visual field. The activation and processing at this level creates several electrical fields, each with a vector towards the right parasagittal and the sagittal electrodes. They produce a robust P100 in these electrodes. So remember, left hemifield stimulation of the right eye produces left-leaning P100s. Right visual hemifield stimulus of the same eye produces right-sided P100s. So the answer to this question is A. Next question. Left eye, left half field stimulation will produce P100 waves over the left parasagittal occipital electrodes. A true, B false. Now let's see what happens with left eye is stimulated by the left half of the visual field. The left visual field stimulation of the left eye activates the nasal retina. The visual pathway from the right eye will not be stimulated, obviously, because the right eye is patched. Neither will the visual pathway from the temporal side of the retina of the left eye, because it is not being stimulated. So the right visual cortex will be activated by a pathway crossing the chiasm, and its activation and also the processing of the information at the level of the right occipital cortex will create electrical fields with vectors towards the left parasietal electrodes and the sagittal electrode. Now let's see what happens when the left eye is stimulated by a right half visual field stimulus. I will not go through the whole thing again. Just remember that right half field stimulation of the left eye produces robust P100 on the right parasietal electrodes and in the sagittal electrode. So the answer to this question is A. Next question. Which of the following parameters has been used for Hemifield pattern reversal interpretation? A. Presence or absence of P100. B. Interocular hemifield latency difference. C. Monocular hemifield amplitude difference. D. All of the above. So the question is, what is interocular hemifield difference? One of the parameters that has been used to evaluate hemifield visual evoked potentials is interocular hemifield latency difference. This consists of comparing the latencies of P100 produced by the right half visual field stimulation of each eye. The arrow indicates the two right-sided hemifield being compared during interocular hemifield latency difference estimation. The cream arrow indicates the P100s being compared, that is the latency of the right eye RO P100 with the latency of the left eye RO P100. Now in this frame, the arrows point to the stimulation of the left visual field of each eye. The cream arrow indicates the P100s being compared, that is, the latency of the right eye left occipital P100 with the latency of the left eye left occipital P100. The same comparison can be done with the amplitude, in which case we talk about interocular hemifield amplitude difference. Now we must address another issue, which is what is monoocular hemifield difference. Monoocular hemifield difference can be determined for latency and amplitude. I will start talking about latency. The monoocular hemifield latency difference is determined by comparing the left and right P100s at the left occipital electrode arising from the left visual field stimulation and the P100 from the right occipital electrode arising from the right visual field. And from the left eye, we can arrive to the same differences by comparing the P100 at the left occipital electrode with the P100 at the right occipital electrode. We can do the same with amplitude. Next, we need to ask ourselves about using the absence of a response as abnormal and the presence of a response as normal. Absence abnormal, presence normal is the simplest and most reliable parameter for Hemifield interpretation if you want to avoid calling abnormal studies in the presence of normal MRIs. The bottom line is that all these three parameters have been used by different authors to interpret Hemifield pattern reversal visual evoked potentials. So, the answer to this question is D. Next question. Which of the following parameters is most often used for Hemifield pattern reversal interpretation? A. Presence or absence of P100. B. Interocular hemifield latency difference. C. Monocular hemifield amplitude difference. D. Monocular hemifield latency difference. Unless you were asleep, something that happens often when I give a talk, you know the answer to this one. By far, the most, perhaps the only clinically reliable way to decide normalcy when interpreting a Hemifield pattern reversal visual evoked potential is to use the presence of P100 as normal and the absence of P100 as abnormal. So the answer to this question is A. Please take a few seconds to look at this panel and decide what is your interpretation. A. Right optic nerve lesion. B. Chiasmatic lesion. C. Right post-chiasmatic lesion. D. Left post-chiasmatic lesion. When all is said and done, using the presence of P100 as the criteria for normal and the absence of P100 as the criteria for abnormal, 5 patterns emerge according to the site in the visual pathways that is involved. When the right optic nerve is involved, this pattern consists of absence of P100 to right eye stimulation after both right and left hemifield stimulation. When the left optic nerve is involved, no P100 is found upon stimulation of the right or left hemifield of the left eye. When the lesion is at the chiasm, stimulation of the right visual field of the right eye and the left visual field of the left eye do not record P100s. The best way I remember this is by linking bitemporal hemianopia, nasal retina, and chiasmatic lesion. So we will see absence of P100 in the right eye following right eye hemifield stimulation, and absence of P100 wave following left hemifield stimulation of the left eye. This is, as I just mentioned, the equivalent to the classic bitemporal hemianopia. The fourth pattern is that of a right postchiasmatic lesion. This pattern is characterized by absence of P100 with left hemifield stimulation of the right eye and absence of P100 with left visual hemifield stimulation of the left eye. The fifth and last pattern is the one that occurs with left postchiasmatic lesion. This pattern is characterized by absence of P100 in the right eye with right visual field stimulation and absence of P100 in the left eye with right hemifield stimulation. So the answer to this question is B. Next question. Which study would you choose to selectively study the left optic tract in a person with a left blind eye? A. Binocular stimulation. B. Right eye left hemifield stimulation. C. Left eye left hemifield stimulation. D. Right eye right hemifield stimulation. The left optic tract is indicated by the arrow. The right eye right visual hemifield stimulation evaluates the left postchiasmatic pathways. It activates the left occipital visual cortex and creates a field with a vector towards the right side. Left eye right visual hemifield stimulation evaluates the left posterior chiasm pathways, activates the left occipital visual cortex and creates a field pointing towards the right side. But since the person has a left blind eye, then the left eye cannot be used for testing. So the answer to this question is D. Next question. Which hemifield of pattern reversal visual evoked potential testing are likely to be abnormal with a left optic tract lesion? A. OS left side visual field and OD right side visual field. B. OS left visual field and OD left visual field. C. OS right visual field and OD left visual field. D. OS right visual field and OD right visual field. This frame depicts a representation of a visual field pathway with a left optic tract lesion. Now, the left eye is being stimulated by a left half field stimulus. This is captured by the nasal retina and transmitted to the right visual cortex. This is normal. But where the stimulus be placed on the right half of the visual field of the right eye, it would involve the temporal retina and the image transmitted to the left occipital visual cortex going through the left optic tract and radiation. This is abnormal in patients with left optic tract lesions. If, on the other hand, a left stimulus is applied to the right eye, the visual evoked potential will be normal. But if the right half of the stimulus is applied to the right eye, then again the visual evoked potential will be abnormal. So if we put it all together, we can say that right visual hemifield stimulations are the preferred visual evoked potential test that should be done to evaluate a left optic tract lesion. So the answer to this question is D. Next question. Please take a few seconds to look at this frame and choose the correct answer. A. Chiasm. B. Left postchiasm. C. Right postchiasm. D. Optic nerve. Left visual field testing is captured in the first panel. This panel includes the left and the right eye. I have represented the anatomy and the physiology of such testing in the cartoon above the panel, as you can see. And it is normal. In the next panel, I have done the same representation, but it is abnormal because, as you can see, no waves are present. So the answer to this question is B. Next question. Binocular left hemifield stimulation produces a higher amplitude wave than left eye left hemifield stimulation. A true, B false. In a normal person, a left hemifield stimulation of the right eye and a left hemifield stimulation of the left eye, when done at the same time, will combine and activate the right occipital visual cortex. This activation will be stronger than if it would have been just from one of the hemifields on their own. So the answer to this question is A. Next question. Please take a look at this frame and try to determine where is the lesion. A. Chiasm. B. Left postchiasm. C. Right postchiasm. D. Optic nerve. When I look at a question like this with all these panels and all these waves, the first question that comes to my mind is, where should I look first? The answer is easy. It is where the horizontal line is cut by the vertical line. I will start by explaining to you the meaning of horizontal line to show you what it is. These four panels are the visual evoked potentials obtained from each eye by stimulation of one hemifield at a time. This can be done individually, that is one hemifield at a time, or by alternating a stimulus on one eye from the right to the left and then doing the same thing on the other eye. At the bottom of the first panel, I have placed a figure depicting the pathway followed by the electrical activity generated as the left eye is stimulated with a stimulus confined to the left hemifield. The next panel depicts the visual pathway from the left eye, but when the stimulus is confined to the right hemifield. Now, the figure corresponds to the right eye and the left hemifield, and now to the right eye and the right hemifield. The vector of the field of the left eye, left hemifield, goes to the left, as you can see in the green arrow. The vector of the field of the left eye, when stimulated by the right hemifield, goes to the right, as you can see again by noticing the point of the green arrow. The vector of the field of the right eye, left hemifield, goes to the left, and the vector of the field of the right eye, right hemifield, goes to the right. Thus, the derivation to look at when evaluating visual evoked potential for the left eye, left hemifield is the left occipital electrode. 2. The midfrontal electrode. The derivation to look at when evaluating visual evoked potential from the left eye, right hemifield is the right occipital electrode. 2. The midfrontal electrode. The derivation to look at when evaluating visual evoked potential for the right eye, left hemifield is the one that combines the right occipital electrode with the midfrontal electrode. The derivation to look at when evaluating a visual evoked potential for the right eye, right hemifield is the one that combines the left occipital electrode with the midfrontal electrode. The horizontal line to which I alluded at the beginning of this question consists of the wave of each of these derivations. I have represented one of them in the first panel by highlighting them with green color. Now I have placed the vertical line. The vertical line corresponds to time, that is to 100 milliseconds after the stimulus. The place to look at when trying to determine how are the visual evoked potentials when presented with 4 panels as it was in this question is where those two lines cross, that is where the vertical and the horizontal line cross. In this frame I have represented it by green circles. Then you can look at the first panel and consider the position of the P100, which is the place where they both cross. That is where both lines cross. And in this first panel, it is normal. You should consider in the second panel, which as you can see, there's no P100. In the third panel, which is normal, that is the P100 is fine as far as latency and amplitude. But as you recall, when we look at hemifields, the only thing that is important is whether it is there or it is not there. Being there is normal, not being there is abnormal. Finally, we look at the last panel, and here there is no P100. So no waves are generated from the left eye temporal retina, and no waves are generated from the right eye nasal retina. So now when we look at this question, we can answer it. So the right answer to this question is B. Next and final question. The purpose of recording multiple derivations during Hemifield visual evoked potential testing is to help determining the presence of P100 at the left occipital to midfrontal derivation or at the right occipital midfrontal derivation. A true, B false. You can see in this frame 4 panels as you did in the last question. Crossing the vertical and horizontal lines, you can determine the putative location of P100 and confirm its presence in the first panel. You can do the same operation in the second panel and confirm the presence of P100. Again, in the third panel, we can confirm the presence of P100 with no need to look anywhere else in the panel. But when it comes to the fourth panel, we may have doubts as to the presence of P100. But if we look at the sidal derivations, which I have highlighted in green, we can confirm the presence of P100. So the answer to this question is true. Thank you very much for your attention.